At least she's admitting that this is a mess.
Yes, I mean, it is gracious that she's acknowledged, as did Jeremy Hunt, that they're making a complete mess of this. But, I mean, the problem is that this was a crisis that was entirely foreseeable and was foreseen. And, you know, the chief executive of the NHS was not a politician, who's got no party axe to grind, was warning months and months ago about the level of resources that needed to go into the NHS and in social services together in order to head off this crisis. The money was not forthcoming, and the consequences have happened exactly as he predicted.
Are you happy that simply pumping more money into the NHS annually is the best solution?
No, of course it isn't just a question of money, but money is important, and of course money does grow on trees. That's why I and my party argue very strongly that we've got to be honest with the public and accept that there will have to be taxation to pay for it. And we argue that a penny on the pound in income tax would raise roughly the kind of money that the NHS needs to maintain the right level of support for health and social services in the short run. But I mean, the big problem, which is not being confronted, is that the crisis isn't actually in the hospitals themselves. That's just the tip of the iceberg. I mean, the problem is that large numbers of people are going into hospital, cannot then be brought back into the community because there hasn't been the support for social services. And it's this breakdown in the link between social care in the community, which is the responsibility of financially strapped councils, and the NHS, which is at the heart of this issue. And it is, unfortunately, a resources question, and we are going to have to be honest with the public and say to them, look, if you want a decent health service, we are going to have to pay more for it through the tax system.